Okay, for the next session is also very interesting. So now we will listen about fibroid, about adenomyosis, and then we will go to the liver tumor and other indication by the Professor Mohamed Hamid. He is the assistant professor of the radiology and intervention radiology at Cairo University, Egypt. He is the vice president of International Society of Non-Invasive and Virtual Surgery, founder of Hifu, Egypt. So please, Professor.
Thank you. Good afternoon. It's a great pleasure to be here with you. Thank you for a very nice invitation. And I'm always happy to be a part of our Hifu family. Of course, today, I'll give a different concept about Hifu. All my friends and the professors talking about the application of Hifu in gynecological aspect. And of course, the doctors from Oxford giving us and open the windows to treat variable types of tumors with Hifu. Today, I'll give you a brief about how we can use Hifu and actually pushing the boundaries to increase the application of the Hifu. I'm an intervention oncologist, and the intervention oncology is one of the fastest growing specialty in cancer therapy. And it's valid. It can be used in different type of tumors, and we use it either by ablation or different type of embolization. And recently, the oncology intervention considered as a fourth arm of cancer therapy. And of course, it's less painful, less invasive, short recovery, and fewer side effects. And this is the mother of the Hifu technique. So the intervention oncology, we used either ablation or embolization through the skin or through the vascular embolization of different type of therapies. Even we can use the yttrium to ablate the tumors. But of course, the Hifu is considered as the only non-invasive procedure. In our work, we did many surgical applications, and we can use the surgeon issues. We use drilling, we use needles, we can insert the needles in everywhere and in dangerous places, and nearby the aorta, nearby the nerves, inside the lung, and even we can put the needle inside the cervical cord. So the Hifu considered as a heaven for us because it's very dreamable. We just use a beam and kill the tumors, but we must take care. It's very important to take care about the adequate treatment and to minimize the complication. The other aspect of the Hifu, it's as you can see the needle, you can see the catheter. You must be very cautious, and you must take the consideration the multidisciplinary opinion. You must have the oncologist, surgeon, hepatologist, anesthesiologist, pathologist to make sure you choose the right option for your patient. And the Hifu is considered as the sum of all techniques used in surgery, as it's some type of dreams. And of course, the radiologist succeed to help the people in this dream, because the Hifu is discovered since 160 years. But the dilemma, how we can deliver this great power to exact site of the tumor. Because the Hifu power is an old power, but how we can direct this power and kill the site we need. So with development of the ultrasound and with development of MRI, we can deliver now the HIFU power directly into the tumor and protecting the other structure. The other issue, we are talking about the effect of the HIFU as a thermal effect, but Dr. Fu and Dr. Kim gave us another concept about the technique and the mechanism of action, as it's working by cavitation and it's working by fenestrating of the cell membrane for drug delivery. So we have multiple actions of HIFU. It's not only thermal effect, it's thermal, mechanical, and even make an immunomodulation. The technical theory that we want to carry a definitive power to a definitive point away from the skin by 12 to 16 centimeter to give the coagulative necrosis by temperature above 56. And what is the very nice for HIFU, as the patient is lying down and we are moving around the patient. And this is very easy to the patient. As we said, there is two techniques, ultrasound guided and MR guided. But of course, the ultrasound guided is more and more and more efficient. This is my opinion, scientifically and by experience. It's very advanced, it's applicable, easy. And of course, there is a lot of evidence regarding the publication related to the HIFU, especially in tumor ablation. Also, there is another issue. And many people working with ultrasound, they told us they can't clearly see the boundaries of the tumors. And I show you, this is a very small pancreatic uncinate process tumor, and we can see it very clearly, and we can marketing all the boundaries of the tumor. So maybe related to the positioning, related to a good preparation, related to the good power of ultrasound machine, we can clearly see the boundaries of all the treatable tumors, either fibroid, pancreatic, liver, or even musculoskeletal tumors. Of course, the HIFU application is increasing every year. And we can see the number of the patient and the number of publication is increasing, especially in last 10 years. So this is very good. And now we can searching for evidence-based researches. There is a multiple systematic review. There is many books and clinical trial about the HIFU. We have a very wide range of application of HIFU. They're very wide range. There is a neurological application like an essential tremor, pain, Parkinson's disease. And this is now the essential tremors and Parkinson's is FDA approved treatment for HIFU, by HIFU. And of course, we have a musculoskeletal application like back pain, osteoid-osteoma, and the osteoid-osteoma now is FDA approved. And in oncology, and this is the most growing field, we have a lot of application of oncological treatment. And of course, we're not aiming only to destroy the tumor directly, but as we talked about the effect of the HIFU, we want to enhance and adjuvant treatment for many other treatment. And many applications are under treatment. And I saw a case of varicose veins, now treating the varicose veins and perforator by the HIFU. And this is very nice new application. Of course, there is 1,000 of patients treated by HIFU around the world with different application. And this means you are not the only one treating by HIFU. There is a lot of people treating HIFU and treated by HIFU. But we need to enhance and illustrate what is the effect of the HIFU. The HIFU is very nice. It's non-invasive, repeatable, no ionizing radiation, very high safety profile, no need for hospitalization. Next day, you can return to work, to normal life. But we must know this point, very important. We must know very well the anatomy. And we must study very good the positioning of the patient. And according to the positioning of the patient, it's the different organs where it move. If you put the patient in a prone position, different than right lateral position, different from supine position. So the positioning is very important. The surgical approach is another issue. If you're treating a patient of musculoskeletal tumor, you must study what is the surgical approach by the surgeon. If you're treating a fibroid or adenomyosis, you must understand what is the approach of the surgeon. And of course, at the liver and pancreas. And this is very important to understand this issue. The direction of power, this is very important. You know, if you're working with radio frequency, Hifu, microwave, and laser, there is back power and directed power. You must know what is the direction of the disparate power after you put it in the tumor, because the reflected power may be hazardous in some issue. And in Hifu, you must take care about the triangular of energy. The triangular of energy, you may hit the bowel or hit the skin or hit a scar nearby your triangle. So this is very important. And you must try to use the least power. No need to increase everything and face problems. Start gradually and make a calculation before treatment. And this is, for my opinion, is the equation. If the distance is less, the size is less, the vascularity is less, you will get a better effect and less time. So any procedures like sonographical ultrasound or embolization or choosing the patient very well, any effect to decrease the size, to decrease the vascularity, and to decrease the distance from the bowel to the tumor, you will get better effect. And of course, regarding the oncology, there is many tumors treated or partially treated by Hifu, like the metastatic colorectal cancer, pancreatic cancer, liver tumors. The Hifu is sharing in treating this disease. So, and this disease, especially the pancreatic and the liver cancer, not under control till now, and suggested to increase, not to decrease. This is not like pancreatic cancer. The pancreatic cancer is partially controlled, but the breast cancer, the breast cancer is partially controlled now, but the pancreas and liver cancer increasing and will increase. So the first application is the Hifu in liver cancer. What I mean by liver cancer, I mean the systemic, the primary HCC and secondary cancer. Till now, the ultrasound-guided Hifu GC is the only machine certified to treat the liver tumors. There is many studies talking about this, and this talking about the safety, talking about the efficacy, talking about the very good effect of Hifu and even long-term treatment. And you can see the Hifu regarding to its nature. It's very safe to use the Hifu beside the blood vessels. It's not traumatic to large vessels. And so you can use the Hifu in hilar, aortic, and even near the IVC, in the tumor beside the hepatic veins. So it's very safe regarding the blood vessel, not like other different types of ablation. You can see, you can preserve the IVC, the portal vein. Sometimes you can use the Hifu in combination with chemoembolization, and this is what enhance the effect of Hifu. I show you the literatures first, then I'll show you our experience in our patient in Egypt. Also, there is some cases you haven't any treatment you can do. If you have a patient with HCC with metastatic hilar lymph node, how you can kill this lymph node? Only you can use the radiotherapy and the Hifu. But the Hifu is more safe and you can do this easily. This is one of the most important studies talking about the effect of the Hifu in HCC. This is released from Hong Kong University, and it's very important to talk about the efficacy of the Hifu compared to the radiofrequency. It's almost efficient as radiofrequency, and the over 3 years survival is about 90%, and it's safe in carrying treatment of HCC with very low risk. But of course, we should carefully choose this patient. And if we can use the radiofrequency in some location, because it's more popular, it's more cheaper, and many people can do it. In regular universities, we can use radiofrequency, but this opens the window for the high risk radio HCC, and this is very important. Another issue, and I think this is the future of the application of Hifu, is the local regional therapy in the era of molecular and immune treatment for HCC and liver metastasis. And this will change the game. Now in Egypt, we used the ablative procedure, either radiofrequency, Hifu, in combination with immunotherapy, with very good results. And many hepatologists cooperating with us. So this is really changed the game now regarding the application of Hifu. The other issue is pancreatic cancer, and pancreatic cancer is a big dilemma, and there is a very few options to treating the patient with pancreas with Hifu. As I told you, we can see the pancreatic tumor very nice and very clear, and we prefer to put a metallic stent, and the effect of the Hifu on the pancreatic cancer is marvelous. No need for high power, no need for long time. You can use it, but of course, according to the stage of the patient and according to the size of the tumor, you can put the Hifu before the chemotherapy or in the middle of the chemotherapy, or sometimes if it's very small with no metastasis, you can use it alone. And as I told you, it's very safe to use Hifu beside the vessels. There is no incidence of large cell injury at all. This is different cases with Hifu. You can see it. The tumor is turned into hypo intense and even reduced in size and disappeared. The other issue of pancreatic cancer is the pain, and the pain in pancreatic cancer is very annoying symptoms. And of course, the Hifu is one of the efficient treatment of pancreatic pain, as it's destroying the nerve ending, making a cytoreduction of the tumor, and alternating the chemotherapy effect. So it helped very well in pancreatic cancer. As we see, most of the publication related to treatment of cancer pancreas talking about the ultrasound guided Hifu, except one study, about 67 patients, but most of the studies talking about the efficacy of Hifu in treating the pain, and very significant improvement of the pain, reaching up 80% of the patient improved after applied of the Hifu. This is the first indication used for Hifu is bone tumors and osteosarcoma. From myself, I am working with a bone tumor, primary and secondary, treating some patient with Hifu. I think we should consider this application as one of the very promising technique dealing with Hifu, and we must push to put this technique in treating osteosarcoma and bone metastasis. You can see this is the effect after ablation, and you can see this is marvelous effect. Bone metastasis pre and post with reduction of size and new bone formation. This is a very good effect. Also, in some location like chest wall tumors, we can't treat this patient by anything except the Hifu. And this is also some difficult and rare metastatic lesions in the abdominal wall before and after. This is a common question. Does it really work? The Hifu on the normal life, when I apply it myself, these people may be a genius people. They can do this with a different support from God, or they are different people can treating these tumors. This question is an old question. This study talking about the effect of radiofrequency of the liver tumor. Does it really work? Now, the radiofrequency is one of the gold standard treatment in treating the liver cancer. And in most of cases, it's a treatment of choice, exceeding the surgery and exceeding the rest of the time of the management. And even no rule at all for systemic chemotherapy now for HCC treatment. When we start the practice HCC treatment, all the patients treated with chemotherapy with no results. 50% of the patients treated with surgery, and the death rate on table is about 50%. I saw all of this in my country. And of course, we're facing a lot of HCC patients. But now, the incidence of usage of surgery and the incidence of usage of chemotherapy, I think all of you know it's not so famous now. Now, we use the interventional radiology, radiofrequency, chemoembolization, radioembolization, and the Hifu. Maybe in the future, the Hifu will taking place of most of these tumors and sharing in the treatment of the most of your tumor. I'll show you our experience. It's a very initiative experience. We started October 2018. Now I treated 650 cases. Almost half of them are uterine myoma and adenomyosis. We have 7 Hifu babies. And we treating different type of tumors. We treating liver HCC, cholangiocarcinoma, and this is one of the very important application. I think we started this in Egypt, liver metastasis, pancreatic tumor, liposarcoma, aggressive fibromatosis, and benign breast lesions, and of course, bone metastasis. This is our center, and we are honored to have our training program, our first training program from Shangxi and Hifu company outside China at 2018. And of course, Dr. Zhang and Dr. Wang and Dr. Shen, and of course, Dr. Ruzi, my dear friend, came to our center in Egypt. And we also honored by visitors from all over the world. The fibroid in Egypt is different. Most of the patients are virgin. slightly obese. There is a large myoma or multiple. Most of them are above 30. They complaining from uterine bleeding, disfigurement, primary infertility. I just show you some of different cases. I think the fibroid in Egypt, like in fibroid in Africa, it's usually treated in very late stage, very large size, very multiple, and the young or old virgin lady complaining from bleeding or pain, we can treat without contrast because this is not approved in Egypt. The contrast is not approved in Egypt. We treated just guided by blood vessels, and I think this is a very good experience. And I saw this from Japanese experience. They using the blood vessel as a guidance and using the Doppler as an indication, the power Doppler as an indication, is there is a living tissue or not. And you can see this is a variety of cases. We treat a solitary, multiple, anterior wall, posterior wall, even cervical fibroid. We treated the cervical fibroid with a special technique. We push and treating cervical fibroid. The largest size we treated is 14 centimeter. We treated patient up to 14 centimeter. Another application is the liver metastasis. We can see this is a small, hilar liver metastasis from colorectal cancer. In one session, we did Hifu, maybe 210 sonication. And you can see this is the effect by ultrasound just after the treatment. And this is the MRI post-treatment. The portal vein is preserved and the tumor is totally ablated. And this is the MRI for another patient with left lobe, small metastatic lesion. And this is very clear. You can see the ultrasound is very clear by the Hifu machine. You can see it very well. And this is the MRI, and this is what we call the hemorrhagic coagulopathy. And this is hemorrhagic coagulopathy in interventional procedure is the surest sign you kill all the tumor cell till bleed. And this is what we call the hemorrhagic coagulopathy. This is another lesion in segment 6. And the Hifu effect is very powerful. Even it's producing what we call the segmentectomy. You can see at this picture. Of course, we are not aiming for this effect, but this is the final effect. So we must take care about it's a very powerful machine. This is another case with very small hilar HCC in single session. In single session, after 1.5 hours, we can treat it. And even after 6 months, we can differentiate the tumor in the hilar. You can see this is just 1 month after treatment. The second row is 6 months after treatment. And after 1 year, you can't differentiate the tumor at all. This is another case of large hepatic dome lesion. It's not amenable for radiofrequency or Hifu. We decided to start with chemoembolization, 2 sessions of chemoembolization to control the vascularity, and then 1 session of Hifu. And this is the result. Complete ablation of the tumor. You can see this is the follow-up after 6 months, the tumor size decreased. This is another very nice case. This is a case of central cholangiocarcinoma, 25 years old guy. We treated this guy since 3 years. Till now, he is still alive and sending messages for us. He's from Yemen, complaining from This is central pathologically proven cholangiocarcinoma. We put a metallic stent and apply Hifu, and you can see the effect of Hifu. It's very nice. Even the track of biopsy is ablated. And this is MRI. This is what I think is one of the most important application of Hifu is locally advanced pancreatic cancer. And as you see, we use the guidance of the celiac trunk and mesenteric vessels because we haven't a contrast enhanced ultrasound. We go beside the vessels to be sure we are avoid the bowel, and we can apply the Hifu. You see, this is a large pancreatic tumor. This is after second session, after 3 months, after 6 months, after 9 months, there is PET scan is free. 9 months, PET scan is free. But this patient combined with chemotherapy. This is another case with large pancreatic head tumor with metallic stent, with guidance of the mesenteric and splenic and the celiac vessels. We can put the power beside the celiac axis safely with no hazards. And you can see this is the tumor before and after. The after is the second row. You can differentiate between the size and the density of the tumor. This is another case of Anson's process small tumor. He refused chemotherapy and refused surgery and treated only by Hifu. And this guy was cancer-free for 24 months, and recurrence occurred, and we put a stent, and he decided to travel to his country. He originated from Syria, and he's still alive for 3 or 3.5 years without chemotherapy. This is another application. This is a metastatic cancer breast to left hemipelvis with severe pain. Of course, destructive lesions. I decided to start with radiofrequency because radiofrequency will reduce the size and reduce the pain. And after radiofrequency, we can kill a large tumor central part, but still there is some pain. The pain is reduced, but there is some pain. The pain in bone metastasis usually related to periosteum. So we must hit the periosteum in the sacral ala and hit the periosteum in iliac crest. This is Hifu, and you can see we can appreciate the iliac crest and the bone and targeting it. The other era of Hifu is the application in pediatric age group, and this is very important. And they used the Hifu by MR guidance for osteosarcoma or for low vascularity angiomas and aggressive fibromatosis. And we applied this in Egypt in some cases. And this is, I think, this is a different application. This is angiofibroma of the neck. We treated it by Hifu, but we are very cautious. And this is under observation of the surgeon and the high level staff of anesthesia and 2 or 3 doctors. You can see this is before and after. It's reduced, and even the tongue of the patient, she can't extrude her tongue. Now he can extrude her tongue. This is another guy complaining from aggressive fibromatosis with high vascularity. I decided to use an embolization before treating, And I did one session of embolization, then one session of Hifu. You can see this is a very large central area, about 60 to 70% of aggressive fibromatosis did. And you can see there is a notch occurred after ablation. This is before and after. You can see the bulge of the aggressive fibromatosis, and this is after treatment. And this is another patient complaining from aneurysmal bone cyst. We choose to ablate the wall of the different cysts, and the response is fair. And I think also this is a good new application. Thank you very much for listening, and I am sorry for it.
Dr. Hamid, I don't know whether you have experience doing MRI Hifu or not, and how do you compare it? I've never seen MRI Hifu, and I want to ask someone who have done it to compare it with ultrasound based Hifu.
I already before decide to use an ultrasound guided Hifu. I have a tour to see and to try the MR guided Hifu, because this is a very difficult choice for me. Which one I can introduce to our area? I went to many places. The MR Hifu is very lengthy. The positioning of patient is very difficult. You put a large sum of power like a doses, not like ultrasound guided. The ultrasound guided is bit by bit. You put a sonication by sonication. So if you have any complication, you can avoid. And even if you are wrong, you can deviate and change the plane. So this is very important. The other issue, even in USA, which is applies the MR guided Hifu, the publication in USA talking about they can only treat the anterior wall fibroid with efficacy about 60% of ablation. But all of us, all of our professors here and yourself, treating by ultrasound guided, you can find there is a great difference. We can even treat a very small fibroid, about 1 centimeter in posterior wall. I can treat the cervical tumor. They can't do this, all of this. And the rate of complication in MR guided is much higher. What they did now, they trying to make the MRI guided as a semi-automated technique like the radiotherapy. But I think as an interventional oncologist, there's a great difference between the radiotherapy and the interventional procedure. The interventional procedure aiming to kill most of the tumor, not just palliative treatment to release the pain. In interventional oncology and in Hifu and fibroid, you want to treat the patient, not give the patient as a palliative treatment. So this is my very brief about my experience. Of course, I think the ultrasound till now is much more efficient. Maybe the allocation of MR guided Hifu will be in the essential tremors, in the cervical and the lumbar dorsal spine metastasis. Of course, this is more safe than ultrasound guided. And I don't know what about the future. This is just what I know till now.
So thank you, Dr. Mohamed.
Thank you.